Could cutting down severe asthma treatments to twice a year actually be a reality?
The question many are asking, especially now with this Depemokimab.
Right, you sent me a ton of research on Dipimokimab articles, clinical trial data,
Yeah,
and it seems like you're really trying to figure out, is
yeah.
this truly revolutionary or is it just hype?
You hit the nail on the head. The twice-a-year dosing is definitely intriguing, but I really need to understand the data before I get swept up in all the excitement.
For sure, for sure. So we're going to unpack the Swift 1 and Swift 2 trials.
Okay.
These are the major Phase 3 studies that have got everyone talking.
Right.
And to add another layer of complexity, these trials actually took place during the peak of COVID-19.
Interesting. I imagine the pandemic could have really skewed the results.
Totally.
How do we even begin to separate the drug's effects from the impact of COVID?
Yeah, it's a challenge for sure. But before we dive into the trials,
Okay.
let's break down what Depemokimab is and how it works.
Okay. Sounds good.
So it's a biologic therapy, similar to some others you might have heard of like Meplizumab or Reslizumab.
Okay.
But Depemokimab has a key difference.
Okay. I'm all ears. What makes this one stand out?
So Depemokimab targets interleukin-5, or IL-5 for short,
Okay.
which triggers eosinophils,
Right.
those white blood cells that wreak havoc in the lungs of people with asthma.
Of course.
But Depemokimab's design allows it to bind to IL-5 and hold on tight, suppressing those eosinophils for a much longer time.
Okay.
So that's the secret sauce behind the twice-a-year dosing.
Gotcha. So it's not simply blocking IL-5, but doing so in a way that allows for less frequent dosing.
Right.
That's pretty innovative. Now, about those SWIFT trials, you said they were large international studies?
Yes.
What types of patients were involved?
Hundreds of participants from around the globe.
Wow.
To be included patients had to have severe asthma,
Mm-hmm.
high eosinophil counts, and a history of exacerbations.
Right.
Those are the serious asthma flare-ups,
Yeah.
despite being on standard asthma medications.
So meaning these were patients who were really struggling despite existing treatments.
Exactly.
Makes sense. But you also mentioned a specific exclusion criteria.
Yes.
No prior use of IL-5 therapies.
Right. No IL-5 therapies in the year leading up to the trial.
Okay.
This helps isolate Depemokimab's effects,
Right.
but raises questions about its efficacy in people who have tried other biologics.
Right, because that's a common scenario in the real world.
Yeah,
Patients cycle through various biologics to find what works best for them.
exactly.
That's a good point. It's something to keep in mind when we evaluate the results.
Definitely.
Speaking of which, how did Depemokimab actually perform?
Okay, so both Swift 1 and Swift 2
Okay,
showed a significant reduction in the rate of asthma attacks over a year.
okay.
We're talking 58% reduction in Swift 1
Wow.
and 48% in Swift 2.
Those are significant numbers.
Significant numbers.
Yeah, it seems like Depemokimab is holding its own against the current biologics in terms of efficacy.
Yes.
But how do we account for the pandemic's influence on the data?
Yeah, that is the million-dollar question.
Right.
So lockdowns,
Uh-huh.
potentially better air quality, and perhaps even increased medication adherence during the pandemic
Okay.
could have all resulted in lower exacerbation rates overall,
Mm-hmm.
even in the placebo group.
So Depemokimab's effect might appear more pronounced than it would be under normal circumstances.
Exactly.
That's a crucial point to consider.
It is. It highlights the importance of context when interpreting clinical trial data.
Absolutely.
But let's not forget about the patient perspective.
Right.
Fewer attacks are great,
Yes.
but how did people actually feel?
Yeah, good question.
So the trials use the St. George's Respiratory Questionnaire, or SGRQ,
Okay.
to measure quality of life, and the results were a bit less clear-cut.
What do you mean? Did Depemokimab not improve their quality of life?
It did show some improvement,
Okay.
but it wasn't statistically significant.
I see.
This might be because the trials primarily focused on exacerbations as the main outcome.
Okay.
Maybe the SGRQ isn't sensitive enough to capture the nuances of how people feel.
Yeah. I mean, the questionnaire might not capture everything.
Right.
Fewer attacks, less time in the hospital, less disruption to daily life. Those are real benefits that could indirectly enhance someone's quality of life,
Exactly.
even if the questionnaire doesn't fully reflect it.
Precisely. And remember, these trials only lasted a year.
Right.
Perhaps those quality of life benefits would become more noticeable over time
Yeah.
with sustained eosinophil suppression.
It's something future research should explore.
Absolutely.
For sure. Now, before we get ahead of ourselves, let's address safety.
Okay.
What did the trials reveal about Depemokimab's safety profile?
So here's the good news.
Okay.
Depemokimab seems to have a good safety profile.
Okay, that's good.
The rates of adverse events were similar to the placebo group,
Mm-hmm.
and no serious events or deaths were linked to the drug.
Okay, that's reassuring. It aligns with the safety profiles of other IL-5 therapies, which tend to be well tolerated overall. But is there something more to the story?
Well, there were a few cases of elevated liver enzymes in some participants, leading them to stop treatment.
Okay.
Not a huge number, but enough to warrant further investigation.
Definitely something to monitor as more people use Depemokimab.
For sure.
Long-term monitoring will be essential to assess any potential risks.
Absolutely. So for you, the listener, eager to learn more about this potential game changer,
Yes.
here's the bottom line. The Depemokimab shows promise. And that twice-a-year dosing could be life-changing for some.
For sure.
But we need more data.
Yeah.
We need to understand how Depemokimab performs in real-world settings
Right.
outside of pandemic contexts.
Yes.
And we need to know how it works for those who've tried other biologics.
All excellent points. And that brings us to the real-world implications of Depemokimab, something we'll delve into in part 2 of this deep dive.
Stay tuned. We'll uncover the potential cost accessibility challenges and what Depemokimab could mean for the future of asthma treatment. Okay, so we've established that Depemokimab shows potential for those with severe asthma. But as with any new treatment, cost is a major factor.
Absolutely. The Swiss trials focused on efficacy and safety,
Right.
which are crucial, but they didn't delve into the economic aspects. So without understanding the cost-effectiveness of Depemokimab,
Right.
it's really difficult to gauge its adoption in real-world practice.
Yeah, it's a common issue with new therapies.
Yeah.
You have a potentially groundbreaking drug. But if it's unaffordable for most patients,
Right.
its impact is limited.
Exactly.
What good is a game-changing treatment
Right.
if no one can access?
Precisely. But we need to consider the broader picture here.
Right.
Depemokimab's twice-a-year dosing could reduce healthcare visits,
Okay.
potentially lowering costs over time, fewer appointments, less need for emergency care.
Right.
Those are tangible savings.
That's a good point. And better adherence leads to less frequent dosing, could lead to better overall health outcomes,
Exactly.
which could further reduce healthcare costs.
Absolutely.
So if people are empowered to manage their condition effectively,
Yeah.
they can have a ripple effect on the entire healthcare system.
I completely agree. Those potential savings are important, but they must be weighed against the upfront cost of the drug itself.
Right.
So it's a complex equation with many variables.
Sure.
We need to consider both the short-term expenses and the long-term benefits.
And it's not just the drug's sticker price.
Right.
There are costs associated with administration.
Of course.
Depemokimab is given as an injection.
Yes.
So you need trained healthcare professionals, appropriate facilities, and all the infrastructure that comes with it.
Right.
These hidden costs can quickly add up.
Exactly. And we can't overlook the cost of monitoring patients. For side effects like those elevated liver enzymes we discussed, regular blood tests, specialist consultations, these all contribute to the overall financial burden.
Yeah, it's a whole web of expenses.
It is.
That need consideration.
Yeah.
It's a reminder that healthcare costs extend beyond the price tag.
For sure.
Of the treatment itself.
Yeah.
But let's not forget the human costs.
Right.
What about those who can't afford this treatment?
That's the big question.
Will they be left behind?
That's a critical ethical question.
Yes.
Health equity is a major concern.
Of course.
With any new expensive treatment.
Yeah.
We can only hope that as Depemokimab becomes more widely available, there will be programs and initiatives to ensure access for those who need it most.
It's a matter of social justice as much as healthcare.
Absolutely. Now, you mentioned earlier that the SWIFT trials excluded people who had recently used other IL-5 therapies.
Right.
This raises questions about Depemokimab's role in treating those treatments.
Yes.
Who haven't responded well to existing biologics.
It's a key question.
It is, because in the real world, many patients have already tried one or more biologics before finding one that works.
Exactly.
So we need to know where Depemokimab fits into that treatment landscape.
Yeah, is it a potential rescue therapy for those who failed other options?
Right.
Or is it simply another tool in the toolbox?
Exactly. We need more data to answer that question definitively.
We do head-to-head trials comparing Depemokimab to existing biologics, and those who have failed prior treatment would be extremely valuable.
I agree. Such studies could help determine if Depemokimab offers a true advantage for specific patient subgroups.
Absolutely. Such studies could give us a clearer understanding of where Depemokimab fits into the treatment algorithm.
For sure. But as we explore the potential of personalized medicine, we have to remember that asthma is a complex disease.
It is.
It's not a one-size-fits-all condition.
You're absolutely right. We're moving away from those broad classifications
Yeah.
of allergic asthma or non-allergic asthma
Yeah,
and delving deeper into the molecular basis of the disease.
absolutely.
So asthma is actually a spectrum of different phenotypes,
It is.
each with its own unique mechanisms
Mm-hmm.
and potential treatment responses.
It's a paradigm shift
It
in
is,
how we approach asthma.
for sure.
We're recognizing that what works for one person might not work for another.
Exactly. And as we uncover these different subtypes,
Right.
we could develop more targeted therapies
Yeah.
and personalized treatment plans.
It's an exciting time to be in the asthma field.
I agree.
Depemokimab is a perfect example of this progress.
Yeah,
And I know you're anticipating this, but
I am.
we need to remain grounded in the evidence.
Of course, science thrives on skepticism and critical thinking.
Absolutely.
We need to temper our enthusiasm with healthy skepticism.
Depemokimab is promising.
It is.
No doubt, but it's not a cure.
Right.
It's one piece of the puzzle, a step in the right direction.
Right.
But the journey is far from over.
It is.
We still have much to learn about asthma,
Yes.
how to manage it effectively.
Well said. But before we wrap up today, I want to explore another intriguing aspect of Dipimokimab.
Okay.
Its potential implications beyond just reducing exacerbations.
I'm curious. Tell me more.
So let's transition to the final part of this deep dive
Okay.
to explore those exciting possibilities. So we've mainly focused on Dipimokimab's ability to reduce asthma attacks.
Right.
But what if it could do even more?
Okay.
What if it could actually help prevent the long-term damage
Okay.
that severe asthma can inflict on the lungs?
That's an interesting thought.
Right.
We know that chronic inflammation can lead to airway remodeling.
Right.
It's sort of a scarring and thickening of the airways,
Exactly.
which makes breathing even more difficult over time.
And while the Swiss trials didn't specifically evaluate airway remodeling,
Right.
some experts believe that Dipimokimab's long-lasting suppression of eosinophils
Yeah.
could have a protective effect.
That's a fascinating hypothesis.
Right.
If we can interrupt that inflammatory cascade early on,
Yeah.
perhaps we can slow down or even completely halt the
Right.
progression of airway remodeling.
Yeah.
That would be a major victory for patients, wouldn't it?
Huge. Absolutely. It would mean shifting from simply managing symptoms to actually modifying the course of the disease.
That's the ultimate goal of asthma management.
Yes.
Disease modification, not just symptom control.
Right.
But do we have any evidence to suggest Dipimokimab could achieve this?
Well, the SWIFT trials didn't provide direct evidence.
Okay.
But it's definitely a promising area for future research.
I agree.
Imagine if we could not only reduce those attacks,
Yeah.
but also prevent the long-term damage
Right.
that can diminish lung function over time.
That would be revolutionary.
It would.
It would change the way we approach asthma treatment.
Completely, yeah. But let's not forget that severe asthma impacts more than just the lungs.
Right. It affects a person's overall well-being,
Their whole life.
their sleep, their mental health,
Yeah,
their ability to, engage in everyday activities,
absolutely.
the constant worry about the next attack, the limitations on physical activity,
Right.
the side effects of medications, it all takes a toll.
And that's where Dipimokimab's potential impact on quality of life
Yeah,
becomes even more significant.
absolutely.
Even if the effects weren't statistically significant in the SWIFT trials.
Right.
Just consider the psychological benefits of needing treatment only twice a year.
That's huge.
It's a massive shift in mindset.
Yeah.
Imagine the freedom and the peace of mind
Mm-hmm.
that could come with knowing you only have to think about your asthma treatment every 6 months.
Absolutely. That could lead to a cascade of positive changes.
For sure, for sure. People might feel more confident engaging in physical activity,
Exactly.
leading to improved fitness and overall health.
Mm-hmm.
They might be able to sleep better without the fear of those nighttime attacks,
Right.
leading to improved mood and cognitive function.
Absolutely. It's about more than just breathing. It's about living fully.
Yes, but we need to be cautious.
Of course.
We can't overstate the benefits
Right.
based on the limited data we have.
Yeah.
So while the potential is super exciting,
It is.
we need more research to
Yeah.
understand the long-term effects of Dipimokimab
Absolutely.
on these various aspects of health and well-being.
It's important to temper our enthusiasm
Yes.
with scientific rigor.
Dipimokimab is a promising step forward,
It is.
but it's not a magic bullet.
Right.
It's a tool that, if used appropriately, could significantly improve the lives
Yeah.
of people with severe asthma.
Well said. It's a reminder that science is a process
Yes.
of continuous discovery and refinement.
Absolutely.
Dipimokimab is a testament to that progress.
For sure.
And I'm really excited to see what the future holds
Yes.
for asthma treatment.
As we conclude this deep dive into the world of Dipimokimab,
Mm-hmm.
I'm left with a sense of hope.
Yeah.
This new treatment offers us a glimpse into a future where severe asthma is less burdensome,
Yeah.
less disruptive, and less limiting. It's a future where people with asthma can breathe easier,
For sure.
live fuller lives, and maybe even dream of a day
Mm-hmm.
when this condition no longer holds them back.
That's a powerful vision and one worth striving for.
It is. Until next time, stay curious, stay informed, and keep exploring the frontiers of knowledge.